Yeah, I think that there's really three main reasons that I think it's significant that WHO has approved this new malaria vaccine. The first is that it might be more effective than the previous one. The previous vaccine, which was known as RTS S, or Mosquirix, was really a landmark because it was the first vaccine, but it was widely acknowledged that it wasn't as effective as people had hoped. The new vaccine, which is really a sibling to the currently approved vaccine, the new vaccine is called R21, it doesn't yet have a fancy name, may be more effective and is based on the same construct as the original vaccine, so it's really a sibling, and so there's a lot of familiarity with it. And so the fact that it might be more effective than the current one by repackaging the first vaccine into a new improved second generation vaccine is very appealing, and the greater efficacy or effectiveness of preventing malaria in children might result in many fewer cases of malaria amongst children in sub-Saharan Africa when it's implemented. The second major advance for this vaccine is the possibility that it might be more available than the first vaccine. There have been widespread reports that countries that want to implement the current first vaccine haven't been able to get their hands on it and be able to get into the arms of kids who potentially qualify for administration of the vaccine. So having a second vaccine on the market could really improve supply. And I think the third reason why this new vaccine is important is that I think it's a signal to vaccine developers that there's still space for improvements to the current vaccines, and that even though that we now have two in hand, there's always a place for improvements to those and enhancements to make more effective vaccines to protect children in Africa from malaria.